Hey there. Today I'm going to be giving you an informative speech over borderline personality disorder. If you're always trying to be normal, you'll never know how amazing you can be. Now, what is borderline personality disorder? It is a mental disorder characterized by unstable moods. BPD also affects your behavior and your relationships, and it's often found in those 18 years and up. And the term borderline was first used in 1938. According to Crystalline Salters, PhD, in borderline personality disorder statistics, in the U.S., research shows that 1.6% of the population has borderline personality disorder. Women are more likely to be diagnosed with BPD than men. In fact, about 75% of the people diagnosed with BPD are women. Men are often misdiagnosed with bipolar or PTSD. The reason I chose to present this topic to you is because about 3 months ago, I myself was diagnosed with borderline personality disorder. I had no idea what it was at the time. I'd never even would have considered what borderline personality disorder meant, other than my personality was off whack. But after doing a couple of assessments, I found out that I actually have 2 different types of borderline personality disorder, which are the funniest to have in my case, because I desperately need attention from people, and then on the other hand, I don't want to be around people at all, and I'd rather push you away and avoid you. So I avoid people, and then I crave your attention at the same time. How that makes sense, I have no idea, but that is my wonderful life of having borderline personality disorder. It's important to analyze the causes and symptoms as well as treatments of borderline personality disorder. The term borderline was first brought into psychiatric terminology in 1938 by American psychoanalyst Adolf Stern. Stern used it to describe patients who were on the border of psychosis and neurosis, meaning being drastic or irrational. These individuals who displayed particular symptoms under stress, but then soon became relatively functional again. Some of the causes of borderline personality disorder are environmental factors such as neglect or abuse, genetics, brain abnormalities, and altered levels of serotonin. Diagnosed only in those over the age of 18, and if you're younger than the age of 18, your symptoms may appear as having an identity confusion. Because of the background information known on borderline personality disorder, there have been specific causes and symptoms found to be related in this disorder. The causes of BPD vary for each individual, but for the most part, everyone is going to suffer or experience some of the same symptoms. Borderline personality has been linked to the amygdala and limbic system of the brain, the centers that control your emotion, and particularly your rage, fear, and impulse automatic reactions. Some of the symptoms also will include intense fear of abandonment, a pattern of unstable, intense relationships, periods of stress-related paranoia, ongoing feelings of emptiness, inappropriate or intense anger. BPD affects how you feel about yourself, how you relate to others, and how you behave. Also, you may idolize someone one moment and then suddenly believe that that person doesn't care enough about you or is cruel. And for most people who suffer from borderline personality disorder, they each have a favorite person, or a FP is mostly what it's called. It could be a friend, a spouse, your parent, just anybody that you find comfort in and you need to be around them all of the time because you idolize them so much. And as much as it pains me to say this, my favorite person is my husband. He is a pain in my butt, but I could not have gotten through any of this without him. And I'm pretty much obsessed with him 99% of the time when he's not making me upset. Rapid changes in self-identity and self-image that include shifting goals and values and seeing yourself as bad or as if you don't exist at all. Mayo Clinic. Through the many advancements in therapy and medications, the symptoms of BPD have been able to be reduced based on multiple treatment options. There is no cure for borderline personality disorder, but there are many options for therapy available along with the help of certain medications to help you with like depression, anxiety, or mood stabilizers. Some of the treatments also consist of talk therapy, or if need be, if your symptoms are really severe, then you can be hospitalized in a psychiatric unit for your borderline personality disorder. Treatment can help you learn skills to manage and cope with your condition. It's also necessary to get treated for any other mental disorders that often occur with borderline personality, such as depression or drug misuse. With treatment, you can feel better about yourself and live a more stable, rewarding life. Learning to manage your emotions, thoughts, and behaviors takes time. Most people improve considerably, but you may struggle with some symptoms of borderline personality disorder. You may experience times when your symptoms are better or worse. Treatment can improve your ability to function and help you feel better about yourself. Mayo Clinic. Treatments are important for those who suffer from borderline personality disorder, but understanding it is important to anyone who may know someone with this disorder. Now that I have covered the history, symptoms, and treatment of borderline personality disorder, I would like to leave you with one last quote by Julian Seifter. You are not your illness. You have an individual story to tell. You have a name, a history, a personality. Staying yourself is part of the battle. Thank you for listening to my speech, and I hope that you guys were able to learn a little bit more about borderline personality disorder.